Here are a few tips if your child is undergoing squint surgery. There are three sets of tips. The first is before surgery, at the time of the surgery, and after surgery. So, before surgery, here are three things that you should do. The first is pack all the necessary paperwork that you might have done. Maybe your child has had previous surgery, previous admissions, all of that. Squint surgery is a bloodless surgery, so we don't need any blood reports, but it is a general anesthesia, so the anesthetist may need some of your papers. The second tip is to understand what kind of eye drops you have to put before the surgery. So one day before surgery, we want the child to be putting antibiotic eye drops. So see to that. And the third tip is about fasting. So the child is going to be under general anesthesia or sedation, and for that we need at least 4 hours of nil by mouth, meaning no food and fasting. Even water is not to be given. So now during your hospital stay, you should remember that sometimes both the eyes of the baby or the child may be closed after squint surgery, and we keep the eyes closed from 6 to 8 hours. So at that time, what can you do? Here are three tips. The first is carry some kind of music for your child so that they can listen to some music or listen to some kind of audiobook that will keep them busy. The second thing is to order or get your child's favorite foods, because after all, after they come out of anesthesia, they'll be hungry, and because it is general anesthesia, there is no things like they can't eat solid food and they need to eat only soft food. They can eat whatever they want, so you can get their special kind of favorite meals. And the third tip is, because maybe their eyes are closed and also they are a little groggy, you want to hold your child. So physical touch is a beautiful way to stay connected with your child, and also talking to your child when they've had squint surgery and coming out of anesthesia. So the three tips after surgery are: first is the kind of eye drops that you need to put for your child after surgery. Very important, they will be antibiotics, they will be anti-inflammation and anti-pain eye drops, which you may need to put regularly. The second tip is about screen time. So a lot of parents will say no TV, no mobile after squint surgery. Not necessary. The child is anyway going to be at home, so you can easily give screen time, mobile or TV, which is not going to affect them after their squint surgery. And the third tip is about washing hair or water on the face or water on the eyes. So we want to avoid water in the eyes for at least 2 weeks because of the sutures and the inflammation. And children especially, once you put a little bit of water also, they tend to rub. So we don't want any kind of rubbing, and that is why we say that no water on the face, no water in the eyes, or no hair wash. And I hope that this gives you a lot of confidence to go ahead with your child's squint surgery.